difficult to actually come into standing. What you really do is you get yourself into what we call a neutral pelvis. So I can assist and I can put her into a posterior tilt and an anterior tilt. But what I want to do is I want to get that neutral pelvis. And if you want, I have a picture in your lecture notes of your hand position to facilitate coming from sit to stand and getting that anterior tilt. You're going to notice that the little finger is in the abdominal area. There's a reason it's just the little finger there, because you don't want to give a lot of input into the abdominal area to get that neutral pelvis. You want to bring them up into an anterior tilt, then the little finger just relaxes them slightly. Could you see just that slight movement to unlock her from that locked position of an anterior tilt? That's what we want to do initially to get her to then assist her from sit to stand. Okay, so let's say that she is a right hemi. No, actually, let's make her a left hemi so you can see a little bit easier my position. Now, she's got shoes on, so I can leave my shoes on too. If I had a patient who did not have their shoes on, or if I wanted to put my foot next to hers, I'm going to take my shoes off. Okay? So if she's against the back of the chair, let's do the preparation first. We need to prepare her. Okay? I can get my hand placement, which is going to be this. It's a little difficult hand placement to think of initially. Get my hand placement and bring her up into an anterior tilt, unlock her into that neutral pelvis. Then I can help her scoot side to side to come forward. So the first thing I'm going to have her do is to scoot with her good side, then scoot with the affected side, then scoot until she's at the edge of the chair. Now I want to make sure that if I'm going to sit in my seat, that I'm not inhibiting her from coming up into standing, because we know she's got to lean forward, right? Patients will sometimes feel very comfortable having somebody in front of them, because then they are not as afraid of just falling forward onto the floor. So I'm going to have her place, not around my neck, but have her place her arms on my arms, okay? My position again, I've got her in an anterior tilt. I just, little movement backwards into her abdominals with my little finger. I have her lean forward, I lean back, and she comes into standing. Okay? Then going back down, we can just do the opposite and have her come down. Now, you're going to feel that with her hand placement, you're going to feel, is she putting weight on the affected side to come up? Is she just trying to stand up on her unaffected side? You're going to feel that through the pressure that she puts through onto your arms. Okay? Patients are going to have